we are covering the critical steps for responding to a blood or body fluid spill, a topic you will definitely see on your phlebotomy exam. Questions on this topic test your understanding of OSHA standards and infection control, which are foundational to safe practice. Let's walk through a common exam scenario. You are in a busy outpatient lab and a full tube of blood is accidentally dropped, shattering on the floor. What is the very first thing you do? The exam will offer options like immediately clean the spill, call a supervisor, or place a warning sign. The correct first step, and the answer the exam is looking for, is always to secure the area and ensure you and others are safe. Then immediately don the proper personal protective equipment, or PPE. This means putting on gloves, a fluid-resistant gown, and eye protection before you even think about touching the spill. An exam trap is to choose an option that involves cleaning before protecting yourself. According to OSHA, personal safety comes first. Once your PPE is on, the next step is to contain the spill. This involves carefully picking up any broken glass or sharp fragments using mechanical means like forceps or a brush and dustpan, never with your hands, even if gloved. These sharps must be placed into a puncture-resistant, labeled sharps container. The next phase is to absorb the liquid. You'll cover the spill with absorbent materials like paper towels or a solidifying powder from a spill kit. You work from the outside edge of the spill inward to prevent it from spreading. After absorbing the bulk of the spill, all contaminated materials go directly into a red biohazard bag. Now comes the most frequently tested part of the procedure, disinfection. The exam will test your knowledge of the correct disinfectant and the required contact time. For blood spills, the standard is a 1 to 10 dilution of household bleach and water. The question might try to trick you with other dilutions like 1 to 100. Remember, for a blood spill, it is a 1 to 10 ratio. After applying the bleach solution, you must let it sit for a minimum of 10 minutes. This contact time is critical for killing bloodborne pathogens and is a common point of failure on the exam. A question might ask what to do after applying the disinfectant, and the correct answer involves waiting the full 10 minutes before wiping the area clean. After the contact time is complete, you wipe up the disinfectant with more paper towels, which also go into the biohazard bag. Finally, you must properly doff your PPE, disposing of it in the biohazard bag, and perform thorough hand hygiene. The final steps involve documentation. You must record the incident in the facility's incident or exposure log. If the spill is large or involves a significant exposure risk, you must also notify your supervisor. The exam could present a scenario and ask if supervisor notification is required. To remember the correct sequence, use this mnemonic: don't contaminate, always disinfect, and document. That's D on PPE, contain sharps. Absorb liquid, disinfect with 1 to 10 bleach for 10 minutes, all waste in biohazard bag, and document. Be prepared for questions about the contents of a body fluid spill kit. They typically contain PPE, absorbent powder, disinfectant, forceps, and biohazard bags. An exam question might list several items and ask which one is missing or which one should not be there. Knowing these steps in order, especially the critical details of PPE first. The 1 to 10 bleach ratio and the 10-minute contact time will ensure you are prepared for any spill response question on the phlebotomy exam. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.